First, no matter what you've heard, if you like your doctor or healthcare plan, you can keep it. If you don't have insurance, you'll finally be able to afford insurance. And everyone will have the security and stability that's missing today.
Man, talk about aging poorly. And I'm not talking about Barack Obama. Our insurance costs as a family of four have quadrupled since the passage of Obamacare. What a disastrous piece of legislation that turned out to be. Joining me now is someone who knows a lot more about it than I do, Dr. Kheriaty, author of the book, The New Abnormal, which you really should pick up because what's happening with our medical institutions in this country they're absolutely frightening. Okay, doctor, for those who are not in the medical industry and don't understand, how did Obamacare change your industry?
Yes, so it's a complicated question because it's one of the most complicated pieces of legislation that's ever been passed. There were so many provisions in the legislation that virtually no one in Congress who voted for it read the whole thing, much less understood it. And there's been a lot of commentary on some key things in Obamacare, the individual mandate that required people to buy insurance, and the state-run exchanges where you go online to buy insurance that turned out to be a real mess when they were first rolled out. But the long-term effects, I think, go beyond those two things. We've seen the closing of rural hospitals, and we've seen hospital mergers, which ultimately give patients fewer options in terms of where and from whom to get health care, which obviously contradicts the remarks that you just quoted from Obama, where he was saying, if you like your doctor, you're not going to have to, find another one. Basically, most people now cannot even identify who their doctor is because medicine has turned into a top-down managerialist enterprise where so-called experts at the top dictate how everything is going to go for everyone underneath. And this top-down control has increased the number of bureaucrats. We have more people in healthcare now that are in jobs where they never actually encounter patients than we have people in healthcare that do face-to-face contact with patients, whether that's doctors or nurses or the person who greets you at the office when you walk in. So healthcare costs have grown in large part because of the administrative burdens that have been laid on healthcare systems by top-down managerial control. I'll mention just two other things that probably people experience when they walk into the doctor's office. The first is the physician no longer looks you in the eye, right? Spends very little time examining you or even listening to your chief complaint. Most of the time is spent staring at a computer screen and asking you questions that have very little relevance to what you actually came in to get treatment for. There was a provision in Obamacare basically requiring the adoption of electronic medical records, which sounded like a good idea at first until you realize that it's basically turned physicians into glorified data entry clerks that are having to check a bunch of boxes and ask a bunch of questions and gather a bunch of information for third parties that want that information, rather than attending to the patient who came in with a specific issue that they wanted addressed. Patients feel like cattle being moved through hospital systems now. I don't know if you've had this experience where if you're in a hospital now, they'll actually scan a barcode on your wrist, on your wristband, to log into the electronic medical record system or before they administer a medication. And I understand it's a quality control measure, but it turns people into sort of like a supermarket item. You're made to feel like cattle being moved through this system of turnstile medicine where you're processed by nameless and faceless bureaucrats rather than a doctor or a nurse who knows you personally and can verify, yes, this is the right chart for the right patient because I actually know this patient, I've treated them over a period of time, or this is the right medication for the patient because I'm actually connected to this patient in a longitudinal way. And part of this came about because of another provision in Obamacare that most people don't understand. Medicare stopped paying for services and basically gave us bundled payments for a type of intervention. In other words, this turnstile medicine came about because every hip replacement is treated the same, right? You get one payment to the hospital for doing a hip replacement. And if the patient has a complication, if the patient takes a little longer to recover than average, the hospital basically resents that person because that person is is a liability for the hospital. They're an outlier in this system that's designed for maximum efficiency. So we get hospital bureaucrats, chief medical officers that are obsessed with what they call throughput, which is basically run the patients through the system as quickly as possible. The focus is not on health and healing. The focus is on maximal efficiency. So there's many other things that I could say about Obamacare, but I think to make a very long story short, Obamacare has increased centralized government bureaucratic power over medicine, taken power out of the hands of physicians or small groups of healthcare providers that knew their patients, that knew the needs of the local community. And basically what we're seeing now is a crisis in medicine and strong dissatisfaction with the way medical care is provided, because people feel like they're being treated like an interchangeable widget in a factory machine of medicine, rather than a personal patient that's known by someone who's cared for them over a period of time. That's what Obamacare gave us.
It's so funny you brought that up about the data entry. I just had my physical, just blood work getting done, and standard annual blood work. That's exactly what he did. He walked in with his little nurse and assistant. He sat down in front of the computer and just asked me questions as he's sitting there just clicking things on the mouth, entering things. It's I'm not used to it. I'm not ancient. I'm 43. I'm not used to this kind of medical care.
Yeah, that's right. And some physicians are so fed up with that they actually hire people just to enter a system enter your information into the medical record, which is obviously wasteful, right? The patient should sit there face to face and talk to you and take a history and do a physical examination and run, appropriate lab tests, not just ordering things indiscriminately in order to check a bunch of boxes or to cover all the bases. But that kind of individualized medical care is very hard to provide now, because hospitals and doctors and physician groups are disincentivized to do that. They're incentivized to check boxes, which typically have nothing to do with your health. And the health outcomes are also poor. RFK Jr. has been talking about this recently. Trump has been talking about this more recently after bringing RFK Jr. on board his team, that we spend more on healthcare than any other developed nation, twice as much. But we're like 48th, 49th in terms of healthcare outcomes, because we've created a system that functions like an inefficient bureaucracy rather than a decentralized system that tailors healthcare to the needs of the local population.
How do we fix it? Can medical care go back to any resemblance to what it was as long as we have Obamacare, or is this just what we're stuck with as long as Obamacare exists?
I've been arguing recently, I published a piece in the American Mind about a concept called the parallel polis, which was developed by Czech dissidents living under communism, who basically said, look, sort of the mainstream institutions of society are so corrupted that it's really hard to fix them from within. And so our task right now is to create a parallel civil society, basically create new institutions on new models. And there are models for this. There's new models for medical societies with doctors from Harvard, Stanford, and Duke University. I recently founded a new medical society called the Hippocratic Society, which is, an alternative to medical societies like the AMA that have bought into this managerialist revolution in medicine. There's healthcare cooperatives and new models for healthcare funding and healthcare provision that are popping up here and there. And basically what I think we need to do is support those new models and those new institutions, to grow them, to opt into them, to find new and creative ways of delivering better healthcare for less money. And basically, once the proof of concept is out there, those things will start influencing the mainstream institutions. So I'm not sure that we're going to get, a legislative proposal in the next administration that's going to repeal Obamacare, reform it in ways that would be decentralizing and empowering to doctors and patients and local communities. But we can certainly start doing those kinds of initiatives on the local level without asking anyone's permission for it. So there's a lot of physicians who are opting out of these systems entirely and setting up small practices or small group practices that are trying to deliver healthcare in different ways and try to finance it in different ways. So I think we need more of those kinds of creative, small scale, localized initiatives, the Hippocratic Society that I mentioned being just one of them, but there are other examples of this. And it's probably going to be a 10 to 20 year project of developing those institutions to the point where it's clear that this type of decentralized, localized healthcare system and these new models of delivering care are actually superior. People like them more. They want to go see their physicians more. They're getting better health outcomes. They're actually improving their health. I think it can be done, but we have to start on a sort of small scale and get creative.
I would thank you for coming to my YouTube channel, but I know how brilliant it is, and I know you love it here. So subscribe and watch. We're going to start really ramping things up and putting some funny stuff, some interesting stuff out there, some collaborations. Either way, my YouTube channel is officially the place to be. So stick around.